Here's a quick video on rib harvesting and oblique split technique. This is the 7th rib. You can use the 6th, 7th, or 8th rib. Once the patient is anesthetized, I'll examine the right chest wall with ultrasound and choose the best rib. What I'm looking for is the straightest rib with the least amount of calcifications and one that is below the diaphragm. Ultrasound helps us assess all of these things. Once we've harvested our rib, we're going to use the oblique split method, and you want to assess the rib and plan your split in a manner that's going to yield you the most number of grafts for your desired length and thickness. The idea behind the oblique split method is we want to incorporate as much of the cortex of the rib, the outer cortex, as possible. And the thought is this helps prevent warping. And once you've made your decision, you then will carve several grafts in whatever thickness you desire. Typically, I aim to have the majority of my grafts be approximately 1 millimeter in thickness. You can go thicker or thinner if you desire. Each graft I'm cutting, I have a specific purpose in mind. Especially in revision cases, you need to plan for several grafts using your best judgment and your preoperative plan. Using the oblique split method, you can typically yield anywhere from 10 to 15 grafts fairly easily and still have plenty of rib left over for dicing at the end of the case. The blade that I'm using is a cryostat blade. It's long, it's sharp, and it's ideal for cutting rib in this manner, and I highly recommend it. So you can see we've got about 12 grafts here, varying length and thickness, and plenty of rib left over for dicing. And there's our perichondrium for camouflage as well.